Hello and welcome to the 10th episode of the Microbiome Gazers. This is a platform brought to you by Leucine Rich Bio, South Asia's first microbiome company. Uh, in this platform, we invite guests, speakers, experts who talk about wellness and health, especially in the realm of the microbiome. And today's speaker is Swathi Singh Mehra. She is a certified wellness coach and an yoga expert. Swati, could you please introduce yourself to the audience? Thank you.
Thanks for having me here, doctor. Like Sir explained, I'm a certified wellness coach and a yoga instructor. And my journey into fitness is a long story, which we'll eventually get into. But I'm someone who's going to talk here with my personal experience here.
Excellent, excellent. For the audience, Swati is is a young, vivacious personality. I've had the honor of speaking to her in the backstage, and what I've learned is that she has, taken this mantle of giving good health advice to people of her and our generation. And Swati, if you could begin with your journey of how you became interested in this wellness domain, if you could elaborate on that. Thank you.
Yeah, so I was a rebel teen who badly wanted to reduce weight, who was very unconfident and timid. So in the process of reducing weight, I went through incomplete information on net because Google was just happening. So anything that Google was saying was right for me. It was just like doctor telling me. So I got into such crash diets where I was just surviving on tomatoes, on onion cucumbers to reduce weight, not realizing I'm harming my gut, which is indirectly affecting my immunity. Yes, I did reduce my weight, but along with that, I was gifted 2 months, 2 years of being on bed. And when my friends were preparing for boards, exploring their life, I was sitting on the bed, understanding, what to do next. I've lost weight, but what next? But that was a blessing in disguise for me. I found the purpose of my life then. I got into reading a lot of things about nutrition, about how immunity can actually affect your well-being. Because acne started pouring up on my skin. I literally became half bald. I was on terrible antibiotics, which was affecting my complete digestion process. And I went to the doctor. The doctor told me that you're going to take 3 years for this. But along with good diet, let's see how it can work it out. I went to a couple of nutritionists, did everything, but finally realized one thing that no one in the world will understand your body like you do. And I'm glad I was educated. I was young. I got this opportunity to explore a lot of things, read books, and found the first plan that I ever made was for myself. I made a diet plan for myself. Failed, experimented 2 years. I had a couple of times. 1 month I found like, oh, I'm putting on 1 kilo. Then I suddenly see my acne is bursting out, more hair fall. So I figured out in the 2 years what exactly works out best for which part of the body. And I'm glad I finally healed. And that's how I got into health and wellness. But I was still confused whether to make this as a profession or not. Meanwhile, my sister was also diagnosed with tuberculosis. But unfortunately, in her case, it was too late and I lost her. And that somewhere pumped me up more to take this purpose seriously, where, today health and wellness is not just my career, but also the way I look forward to live, eat, talk. That's how my life revolves around today.
Absolutely. I know how it feels, Swati. It's terrible to lose someone to any disease. And since you spoke a lot about skin health, we will come to skin health and gut-skin connection in a while. But the kind of patients or clients that you encounter in your career or in your day-to-day life, what is the percentage of your clients who come up with issues with their gut, or apparently, or not apparently, which you figure out that they might have some gut connection?
I mean, 99.9%, I mean, everyone who comes to me are unaware that, it's actually their gut doing the harm.
Right.
They think it's lifestyle, but it's not just lifestyle. Lifestyle eventually comes down to gut. Like, people come to me saying that they're following diet, they're working out. I mean, they're following all forms of diet. They've gone to so many nutritionists. But eventually when they come down to me, I figure out that one small thing that can change the complete body game. I don't make them exercise for 5 hours a day. I've had a couple of clients who have been this intermediate fasting. And I understand how bad gut can do. I mean, hair loss, skin care gone, mood swings, getting cranky, relationship getting affected, depression. Most of my clients who have come have also told me that, they cry, they break out for no reason. So, after I consult my client, every day I follow up with them regularly. I'm not someone who has this monthly call. I initially, for the first month, I follow with them every day and ask them, how do you feel? How do you feel? How do you feel?
Mm-hmm.
And eventually, after 25th day, I get a feeling that, I'm feeling light.
Right, right.
And that light happens when you're treating your gut right. So all I focus on is, not what to eat, but how and when to eat.
Excellent.
Once that is settled down, they can know what to eat. I mean, you can have a soup and say it is healthy, but if you're having the same soup at 12 in the night, it is not friendly for your gut. So even
Absolutely.
timing plays a very important role for your gut apart from what you're eating. So yeah, most of my clients are unaware that it's the gut doing the more harm than good. In fact, weight reduction, weight gain, everything is connected to gut.
Well said. As we were discussing on the backstage, starting from Hippocrates to the text in Ayurveda, everything, our old text, that what I meant. They all focused on gut health.
True.
Someone said, like Hippocrates said, that all diseases begin in the gut. And if you look at Ayurveda text, they talk about Prakriti, Agni, Ama, and all
Main thing
those.
being digestion.
Digestion, yes. And it is very, we in India, in fact Indians are, unknowingly maybe, take a lot of probiotics like dahi
True.
and all, a lot of things people take unknowingly. And it's like nani's advice, take probiotics, good for your gut. But unfortunately, the role of the gut, the principal role of the gut in health and wellness is not well understood
True.
by the masses. Forget about the masses. Even mainstream clinicians and many nutritionists, for that matter, they don't give that importance to the gut as they should have,
True.
or they should be. So good to know, Swathi, that you give a lot of emphasis on good gut health for your clients. Which brings me to the next part of the question. When you prescribe or give them diet plans, how do you plan those diets? Do you just tell them that take XYZ food and avoid ABC food, or you make a diet chart? And when you make the diet chart, because what I have understood is, a person who might be showing one clinical manifestation of a particular disease actually might be harboring two or more diseases. For example, in metabolic syndrome, people might come to
True.
you with type 2 diabetes, but that person will also might have hypertension or
True. True.
cardiometabolic diseases. So one disease might show up in the front, but in the back end there might be two or three diseases. So do you treat the disease per se, or do you treat the gut and then it takes care of the disease? Sorry for the long question.
No, that's completely fine. So I just recalled an incident with my client. I recently launched a weight loss program. In that, I ended up not just helping a client reduce weight, but I also treated her thyroid unknowingly.
Excellent.
So she approached me saying that, she is off, she's feeling very underconfident, she wants to reduce weight. I got on board, and usually when I get a client on board, I'm not someone who just spends 5 minutes, sends a mail, tell me everything. No. I personally get on a video call with her for 45 minutes, 1 hour. I form a connection. I want to know what exactly is client thinking, client feeling, client eating. Because until I don't know, how can I form a random diet? I am someone who focuses on personalizing things, because what might be good for me might not be good for her.
Absolutely.
So I understand everything in detail, and that's when I asked her for her blood reports. And I have also realized a lot of people don't get these routine blood checks done. Vitamin D being the very normal thing,
True.
a very normal thing that people like vitamin D hi to kam hai, but it's a big deal. So in
Correct.
the whole process, I gave her a diet plan. I was seeing certain section of results that were supposed to come was not happening.
Hmm.
Then the symptoms that she was showing me was of thyroid and
Okay.
also diabetes. So
Yeah.
got her checked. Eventually, she was clinically diagnosed with it. Then I referred her to a doctor's, and that's how we got into it. So coming back to the question, when I get my clients on board, I'm someone who understands everything about them, where they come from, what have they grown up eating, how do they communicate with the body, because a lot of us forget communicating with the body. So for example, if I'm having rice, am I feeling bloated, am I feeling light, am I feeling sleepy? After food, you're not supposed to feel low, you're supposed to in fact feel happy.
Hmm.
That's another sign that people ignore. So I first give them a diet, and then I absorb them for good 1 week to 15 days to actually know their body better than them.
I see.
So once I know that, then I start customizing more in detail. And that's when, for example, one of my clients was doing everything fine. Yet, she had terrible acne breakouts,
Mm-hmm.
bloating issues. She
Mm-hmm.
was very thin, but she has terrible bloating issues. So all I realized, one simple buttermilk changed her game. So she used to consume buttermilk.
Mm-hmm.
Ideally, it is supposed to be very good for digestion, but in her case, it didn't suit her gut. So taking out buttermilk helped her. So again, it goes back to understanding the client in detail, and I have no fixed plan that I'm only going to give you 2 diet plans. I'm going to give you 3. For someone, it might work at 1. For someone, it might work at 30th. So it's about
True, true.
understanding, knowing each other.
This is interesting. So when you said that you took out buttermilk from your client, what made you think that buttermilk can be the real culprit? Because
See,
as you,
honestly, with me, I saw her feeling bloated terribly. I observed, see, physical, when your gut is not doing fine, it shows out physically. Acne breakouts, hair fall, bloated, constipation, not feeling hungry for dinner, and suddenly feeling hungry and getting cravings at 9:30. So
Mhm.
all these things were happening. I just had a trial and I'm like, let's take out buttermilk. Did it for 1 week, and there was a tremendous change in her.
Excellent, excellent. So this is what you have to understand the
Observe.
observe and understand the client's physiology. To there's
True.
no hard and fast rule. There's no
True.
one size fits all
Exactly.
kind of
That's how
thing.
it is.
And in fact, we have also seen Swati, because in the microbiome testing arena that we do, Bugspeaks, we have seen that. I mean, people who outrightly might be doing very well there, but their gut seems to be very bad and then
True.
they come back and say, hey, I'm doing okay. Why is the report showing me bad things? But then they don't know that there are certain things which are lurking in the gut which might not
Exactly.
have manifested at that point in time,
But
but
later.
if it continues like this, sooner or later it is going to manifest. So that's a very important thing that even you are observing in your clients that we do to our testing anyway. um, Very important topic that I thought we would discuss is the gut skin connection. And because you also deal with skin diseases and you yourself have gone through that journey, tell us more about the role of the gut and the skin in your experience, like how you modulated the gut and you saw excellent outcome in the skin. Tell us more about that.
In fact, I'm personally going through it. I'm actually down with a shoulder injury and I'm on strict antibiotics. It has
Okay.
ruined my digestive system completely and I'm having acne breakouts. But one thing that we need to know that, all these things is going to happen. All this is a part of life. Up and down hota hai. 2 acnes, 3 acnes won't matter. But if you're someone who's suffering from a prolonged disease or if you're someone who has had very bad skin for a long time, there's so many people who wake up in the morning and have coffee
Hmm.
and not knowing, when to have breakfast,
Hmm.
and suddenly you see the skin turning up red. So a lot of my clients get attracted towards me because I treat skin health
Hmm.
related to gut.
Hmm.
But not understanding that anyone who corrects the diet, the eventual जो result आता है वो आपके skin and hair पर ही आता है.
Absolutely.
And when something goes wrong to your gut, the first thing that where it shows up, apart from bloating, is your skin and hair only.
Absolutely.
So correcting diet, again, it all comes down to personalizing diet. For example, having tea and coffee empty stomach in the morning. The
Hmm.
worst thing that you can do to your gut, and obviously you're gonna activate your gut in a very wrong way, which will show up on your skin by causing acne.
True.
And not having your timely meals. 3 days you're following timely meals, and on fourth day again you're having late night dinners, brunches, and not skipping your breakfast because time
Hmm.
of the meal is also very important. And apart from that, obviously you always need to eat simple homemade food.
Hmm.
You don't have to take out anything, get anything. And once you stick to these 3 simple rules, everything in your skin and your gut is doing all fine. Because as kids, you always have good skin because life was less complicated.
Yes.
Gut was less complicated. The more you start growing up, you start complicating your gut by not following a routine. So skin is something that it's easily treated when your gut is right.
Well said. Well said. Two things. I mean, the takeaways from what you have said so far is that timing of your food is very important, and
True.
simple food. I mean, you don't have to,
You don't have to
take
complicate,
complicated,
saying
fancy,
prebiotics,
fancy.
probiotics,
No,
nothing.
no, but prebiotics, probiotics are something
Exactly.
which
We
we,
all unintentionally are having it.
yeah,
But what happens is people forget the traditional food and move towards a section of, probably just let me just survive on cucumbers. Let me see whether I'm going to
true,
get good skin.
true.
Let me get on a liquid diet. It's just going to ruin. There should be a balance of everything.
So Swati, talking about diets, so there are various type of fad diets, if I can say so. Intermittent fasting, keto diet, paleo
Yes.
diet. Um, in your experience,
I have a lot of experience in that.
yeah, please do share your experience about all these kind of fads.
See, uh, every time you get into a diet and you're not feeling happy about it, first fast, hard and fast rule, stop it.
Okay.
Because if you're fasting, you're gonna fight with someone around. You're gonna get cranky. You're not gonna feel productive. Because if you're mentally, again, another thing, when you're mentally not doing fine, emotionally not doing fine, the first thing that gets affected is your gut. You'll suddenly see, you don't feel like eating. Your digestion slows down. So, having said that, always follow diet, sustainable diet that you can do no matter where you are, at which phase of life you are.
Okay.
Obviously, one should be little flexible, but following random diets where you're starving yourself, you're struggling, you feel weak doesn't make sense. For example, intermediate fasting. I mean, I'm fasting 3 hours. I happily fast. The fourth hour, I start looking at the clock. Kab aayega khana? Kab aayega khana? I
Right.
mean, in that process, you get so troubled. You feel you're going to get an anxiety attack any minute if you're not going to get your food. It
Mhm.
has happened with me personally when I was doing that, and my
Right.
anger used to come out in certain section of people. It also ruined my relationships. So don't ruin your gut, don't ruin your relationships. Eat food, don't complicate it, and just enjoy life. Gut will be all fine.
Yeah, I mean, of course, stress and gut, again, that the gut brain axis that a lot of people talk about, and stress ruins your gut. There are reports now. Again, microbiome reports. The diversity goes down.
True.
There's abundance of certain microorganisms which are not good, so on and so forth. So definitely, as I always, when I get the opportunity to speak, I always say that your gut microbiota is very malleable.
True.
So your nutrition, your lifestyle, your sleep, everything plays a role. And of
Very
course,
good.
medication is understandable. So there's a new field called pharmacomicrobiomics, which actually looks into that. And in fact, just today there was a report where they have seen that the bunch of medicines or drugs that actually impact the microbiome in a very negative way, gut microbiota. So,
True.
true. I mean, all these things do play a role. Now, Swati, because you had to fight a very what I say is a battle with tuberculosis at a young age, and I think that spurred you to work on the wellness aspect in a much bigger way. Can you share that journey with us? I mean, in the sense, what are the things that you changed to see a better impact or a higher or a faster recovery as compared to not doing that probably would have led to a slower recovery? So just elaborate on that.
Again, and emphasize on time because that's something has changed the whole game personally for me. So eating on time, having the complete proper balance of prebiotics in my meal, and understanding what exactly is going to feed my bacteria for the right my healthy bacteria, diversify the bacteria in my gut for the right ways. I incorporated food in such way because what might suit me might not suit someone else. That and keeping the whole system very uncomplicated and getting myself timely checked and also getting a food sensitivity test done to understand what suits me the best, what doesn't suit me the best. And back then we didn't have gut friendly bacteria test done, and otherwise I would have got that done as well. But today people have that option, and one should go ahead with that to speed up the recovery process. Because one thing, hard and fast rule, like you said, if your gut is strong, automatically you're building a good immunity within you. I mean, right now, the world is talking about immunity. For example, right now, people understand haldi is good, kadha is good, but there are repercussions of that as well. People are overdoing it and ruining their gut again. So you need someone to guide you the right way, and I'm glad I met a lot of people throughout my journey who wished me well, guided me the right way. Family doctors pitching in and telling me, the importance of because when you're into when you're actually bedridden by a disease called tuberculosis, which is affecting your lungs, where you find it difficult to breathe, digestion is something you don't even think because you're just waiting for oxygen to come in. And during such times when doctors come and tell you, focus on your digestion, give you uh, Good syrups. A lot of syrups back then were there, have it before 15 minutes before your food.
Yeah,
They were
enzymes. Basically, those are enzymes, right?
exactly enzymes, so that you can eat your food on time. So yeah, a lot of things worked out for me. A lot of things failed for me, but eventually, what I realized is keeping it uncomplicated, taking action at the right time, and listening to your body. Communicate with your body, because if you don't communicate with your body, even your doctor can't. Because when you go to a doctor, even doctor asks what's happening to you. If you're unaware what's happening to you, how will you communicate it to the doctor? So
True.
that's how it is.
Mm. Now, this is again a very interesting and important take-home message for all of us. And Swati, again, I'll go back to one of my previous questions. Uh, what kind of people or clients that you see have infectious diseases who come to you for new? Because why I'm asking this question is because we take infectious diseases for granted.
Yes.
We say we'll take antibiotics, antivirals, we should be fine. But the fact that nutrition plays a very, very important role, many people don't understand. So any insights on how many people with infectious diseases approach you for nutritional guidance, or it's
I'll be
very
very
less?
honest. I'll be very honest. The percentage is just two. When I launch a weight loss program, I have better,
Yeah.
and that's when I deal with their other things. So
Mhm.
but whereas I launch a thyroid specific, diet plans or something, it's very very rarely people who literally have been through and seen the tough times of that particular disease.
Right.
They come. Until then, people take it for granted. For example, migraine being a normal thing, people ignore migraine.
Hmm.
Whereas migraine is something that can again be treated from the root cause with the help of correcting your gut.
Okay.
That is
That's
also
very,
something.
very interesting. Recent episodes of COVID and all has also shown that that food really plays an important role.
True.
I mean, many people don't get that importance of food on their body, especially during infectious diseases, because at
Exactly.
that point of time it's just the medication that they are worried about.
True.
Uh, Even in
Medication does more harm than good. I mean,
true,
if five after a point, you in fact you need food to take up the medication.
correct.
What happened with me? This was my personal story. When I started the medication, I was a little careless about the food. You just want to gulp medicine and finish. After 20 days, I reached a point where seeing medications, I would feel pukish because my body didn't have the strength to take the medicines. My
Correct.
urine turned red because of only taking medicines and not having food. So that bad was my condition. So I couldn't take medicine. So eventually, I was forced to eat food and then take medication.
Well said. I mean, you just hit the nail on the head. Medicines are an essential evil. You need, and when you have some infectious disease, you need antibiotics. Again, if you have bacterial infection, and if it is absolutely necessary. Otherwise, your body heals on your own. A lot of the times when we have cough and cold, we don't take medicines, right? And we should not.
True.
Your body heals on your own. So you give your body enough tools to fight the infection, and one of the important tools is nutrition. So go ahead and talk to Swati, anyone in the audience, if you have any infectious diseases. Okay, we are coming to the end of our session, Swati. Last question to you is any advice on good food versus bad food? We all know about bad food, so need not tell us about it. But good food, in your experience, in your journey, which you think is kind of superfood that people should take, or is there anything like that?
See, the concept of superfood again is very personal. I always sum down and vouch for personalization, but there are three simple rules: always eat fresh, always eat local, and always eat something connected to your roots. For example, if I'm someone who's grown up eating a certain section of food and suddenly I munch into burgers, which is healthy for a certain region of people, and consider that as my main meal, my gut is going to go for a toss. And always focus on healing your digestion the right way rather than going for antacids, because
Mm.
they just ruin it more. And keep your chai as a small beverage drink and not as a mean of moving forward. Don't replace your chai with water, because I've seen a lot of people will drink more cup of chai versus more glasses of water.
Right, right.
And another thing, just because water is healthy, don't overdo water, because a lot of people have this, oh, I have to finish 4 liters of water today.
True.
And the first thing that they do in the morning, unknowingly thinking it is very healthy, force their system to consume 2 liters of water at one shot and be happy. Acha, aaj mera 2 liter ka ho gaya. Once you realize they're actually flushing out all the healthy nutrients of your body, or rather than that, sip your water and hydrate your system and enjoy the goodness of it, because hydration indeed makes you feel light.
Excellent. So with these thoughts, ladies and gentlemen, we come to the end of the session. As I said, Swathi, there are many people who probably are seeing this live on our various channels. I would encourage people to visit Swathi. She has an Instagram account. She's an influencer, Instagram influencer. So people with any nutritional needs, please do visit Swathi. And thank you, Swathi, once again for spending your valuable time with us. It's a platform, as I said in the beginning, for people to understand health and wellness, especially with respect to the microbiome. And right now we are talking about the gut microbiome. So thank you once again, Swathi, for being part of this episode. We hope to have you again in some of the other
Same
episodes.
here. Thanks for inviting me and listening to me so patiently.
It was a pleasure, Swati. We will at least I learned a lot from you. Okay. So thank you so much. Thanks a
Thank you
lot.
so much. Thank you.
Bye.
Bye. Take care.